Now to Geneva, where Dr. Emanuele Capobianco, a Chief Strategic and Impact Officer at the World Health Organization, joins us to discuss the rescue efforts launched in Turkey. Emanuele, we continue to see an outpouring of international aid for Turkey. Nearly 100 countries are now giving assistance. What has the World Health Organization's role actually been in the search and rescue operation?
Thank you, Charlotte, for having the WHO Foundation on the program. The World Health Organization has immediately responded with the colleagues that are on the ground to the dramatic events over the past few days. And the World Health Organization really aims to provide the services, the health services for people in need. So the immediate need over the past few days have been to provide trauma care for people that are being injured. And we know there are more than 80,000 people that have been injured for this from these earthquakes. And these needs are still there and will continue to be there. So trauma care is absolutely critical in bringing in the right supplies in order to be able to operate the people that may have a fracture, in order to be able to donate bloods to the people who may need transfusions is critical. The second very big priority is provide access to essential medicines. In a context like this one, if you are a diabetic person and you don't have insulin, you may die. In a context like this one, if you have hypertension and you don't have your medicines, you may die. And in a context like this one, if you are a pregnant woman who is not receiving the adequate care, you may have your own life or the life of your child at high risk. And then I would also add, there is a huge increasing demand on psychological, psychosocial services, given the enormous psychological trauma experienced by the survivors.
Well, as you said, huge trauma for the survivors, particularly as they're now experiencing having to just survive in freezing conditions, the lack of water, food, just those basic necessities. So you say you're helping on that front, but is that the growing fear that there could be a second national disaster in terms of not just spread of disease such as cholera, but also hypothermia?
Well, there is certainly the desire and all the efforts to avoid people from further sufferance. But right now, with the current conditions on the ground, hypothermia is a big risk. Right now, given the conditions of the water supply system, there is a risk of potential epidemics. This is why it is absolutely critical to bring in those supplies that can, on one hand, make sure that the water is clean. So WHO is intervening with water purification tablets to be used to ensure that the water supplies are safe, and also ensuring that the shelter is provided, that the blankets are provided, so that the risk of hypothermia is avoided. And let me just be clear, there is not a single one agency that can help. It's really the coordination of all the agencies on the ground, the local actors on the ground that can help to reduce the risks of further death and sufferance in the populations affected.
We talk about the coordination there. It's not just been the damage from the earthquakes, but the logistics of actually getting aid to the disaster zones. So my question to you really has to be, what challenges have you been facing? And, have your rescue operations been successful so far? And that's a really difficult question to answer.
So one, the gravity and the extent of the consequences of this earthquake is so big that it's very difficult to respond fully. So there is an absolute need to scale up the amount of goods that are trying to reach the people in need. And that's why the WHO Foundation has raised an appeal for 40 million to support the WHO efforts in that. The second one, though, is once we get the supplies arriving in the various parts, we need to bring them very close to the population. And we know that this has been very difficult because of the logistics issues linked to the disruption of road system because of the earthquake, but also for the difficulty in access, particularly northwest Syria. And what is being done at the moment is to try to increase access to this northwestern part of Syria from the southern border of Turkey. And we need to increase the number of entry points, and also to increase the amounts of convoys that from the south, so in what is called the cross-line operation, from the south of Syria, move up to the northern part of Syria. So there is a lot of work that needs to be done to create better access for the people who are in dire need, and are also people, particularly in the northwestern part of Syria, who have been dealing with a 12 years long war and is people that have a very weak health system to provide services for them. So it's a priority really at the moment to get access for these populations in need, and continue to gain access to all people in Turkey and Syria who are in desperate need of all type of support. And as a World Health Organization, we are focusing primarily on the health needs, but also collaborating with all partners to ensure that shelters, water, and nutrition supplies come in at the earliest possible.
Well, ultimately, for both Syria and Turkey, it's not just a relief mission, but also a rebuilding operation. Will aid still be coming from WHO and other countries once this falls out of the international headlines?
It's a difficult question, Charlotte, to answer. And the answer is really on how well the world will be responding to such a dramatic crisis. I want to be optimistic, but if we look at what happened, for instance, over the past 12 years in Syria, this was not on top of the news, and aid has not really been coming. We need to avoid that from happening again. We need commitment from all partners, government partners, international donors, private sector, foundations, and also the general public to maintain the focus and maintain the support, financial support, to help the people in need. Will be for many months and years dealing with the reconstruction efforts. We'll be dealing with the physical and psychological consequences of these terrible earthquakes. And the World Health Organization will do its best to be at their side of the people who are suffering, who have been really hit hard by this terrible tragedy.
As you say, aid is going to be more important than ever in the coming months. Emanuele Capobianco, thank you for joining.
Thank you.